Now coming to epistaxis. Epistaxis is the bleeding from the nose. So epistaxis is bleeding from nose. So what is the blood supply of the nasal cavity? So nasal cavity, if we divide the nasal cavity into four quadrants, it is the anterosuperior quadrant, it is anteroinferior, it is posterior superior, and it is posterior inferior quadrant. So anterosuperior, anteroinferior, posterior superior, posterior inferior. Now anterosuperior quadrant is supplied by anterior ethmoidal artery, and the posterior superior is supplied by posterior ethmoidal artery. Anterior ethmoidal artery and posterior ethmoidal artery are both the branch of ophthalmic artery, which is a branch of internal carotid artery. So they are the branch of ophthalmic artery, which is a branch of internal carotid artery, which is a branch of internal carotid. So internal carotid artery supplies, a branch is ophthalmic artery, which are divided into two: anterior ethmoidal artery and posterior ethmoidal artery. Anterior ethmoidal artery is coming through the anterior ethmoidal foramen, and posterior ethmoidal artery coming through the posterior ethmoidal foramen. Anterior ethmoidal foramen is lie 24 millimeter from the lacrimal crest, and posterior ethmoidal artery lies 12 millimeter from the anterior ethmoidal foramen. Now 6 millimeter behind the posterior ethmoidal foramen, there lies the optic nerve. Now anterior superior is supplied by anterior ethmoidal artery, posterior superior is supplied by posterior ethmoidal artery. Anterior inferior is supplied by facial artery branch. The nasal branch of the facial artery supplies the septal branch of the facial artery supplies the anterior inferior part, and also the anterior inferior is supplied by the greater palatine artery, and the posterior inferior is supplied by long sphenopalatine artery, and also long sphenopalatine artery supplies the anterior inferior quadrant. There is the plexus, there is a anastomosis between anterior ethmoidal artery, which is a branch of internal carotid artery, facial artery, the branch of facial artery, the greater palatine artery, and the long sphenopalatine artery. These three arteries are the branch of the external carotid artery. So there is an anastomosis between the internal carotid artery and the external carotid artery in the anterior inferior quadrant. This is known as Little's area or Kisselbach plexus. Now it is the most common site, 90% case it is the most common site for the epistaxis. Now it is most common in the children, but in case of old age group, their epistaxis is much more common in the posterior inferior part or posterior part, which is supplied by ascending pharyngeal artery and a nasal branch of the long sphenopalatine artery. So there is an anastomosis, and there is the due to hypertension there is the bleeding. So this is another cause of the bleeding in case of elderly person. Now another cause of bleeding can be from the retrocolumellar vein, okay, from the Woodruff plexus, venous plexus. Now the anterior superior, the superior part, if we think that this is the superior, this is middle part, and this is the inferior. The superior part, the venous supply drains to the ophthalmic vein. The superior part drains into the ophthalmic vein, which ultimately drains into the cavernous sinus. The middle part drains into the sphenopalatine vein, which ultimately drains into the pterygoid plexus and ultimately to the cavernous venous sinus. And the inferior part drains into the facial vein, which ultimately drains into the cavernous sinus through pterygoid plexus. Now this area of the nose is the dangerous area of the nose. So then any infection can lead to the spread from the infection from the venous plexus to the cavernous sinus and cause cavernous thrombophlebitis. So this is the dangerous area of the face. The nose is a dangerous area of the face. Now, what is the cause of epistaxis? Epistaxis is basically caused by local cause, general cause, and idiopathic cause. Local cause due to any trauma to the nose, intranasal surgery, fracture of the nose, middle one third, any violent sneezing, infection like viral rhinitis, sinusitis, atrophic rhinitis, any TB, granulomatous diseases of the nose, septal perforation or any abscess, deviated nasal septum, neoplasm, any hemangioma, any rhinolith or any carcinoma, foreign body, if there is any atmospheric change, Cassian's disease, or any nasopharyngeal cause like adenoiditis, angiofibroma, juvenile angiofibroma, or any malignant tumor. These are the local cause. What are the general cause like hypertension, pregnancy, mitral stenosis, hepatic diseases like cirrhosis of the liver, chronic nephritis, mediastinal tumor, any viscerous menstruation, acute infection, influenza, acute infection like influenza, measles, chickenpox, typhoid, or any pneumonia or malaria. So what are the site of bleeding? I have already told that it is 90% cases it is from the little's area. Retrocolumellar vein, posterior epistaxis in elderly person due to hypertension, also in the uterus venous plexus, the inferior uterus venous plexus which is present inferior to the posterior end of the inferior